Well, at the opening of the neonatal unit up at Nobles Hospital, I thought it was a good chance to get hold of the Minister. I want to talk, we're doing something else with it, about that. I want to talk to you about New Zealand, which seems to be still exciting. And then from the word go, you knew it was going to be a bit of a backlash about going all that way for what people are perceiving that you could have gone somewhere else.
Right, well, it's disappointing with some of the comments, but why are we going? Well, the reasons why we're going is that we have a health service that clearly isn't the way forward. I've got waiting lists that I'm not proud of. We need to make significant changes. We're being inspected by the West Midlands Quality Review Service, and that's just for us to catch up with the UK's NHS. And the UK NHS are in crisis themselves. They've got problems, funding problems, etc. And I'm a new minister, and I wanted to deliver the very best health and social care services we can to the people of the Isle of Man. Now, what do? You look around and you see who are giving the very best health services to their people in the world. And the King's Trust, who are based in London and they are internationally renowned as experts in health service advice, they have said that the Canterbury model in New Zealand is the best system in the world at looking after providing a healthcare service, integrated healthcare service to the people of the Isle of Man. Now, we currently have a budget of 240 million gross spend, 180 million net spend, and I think roughly our budget is 140 million for health net. In the next 20 years, if we make no changes, it's projected conservatively to double in 20 years from 140 million to 280 million. Now, when you take into account the demographic problems that we have to address, they're not going to go away. There are 3.4 people working for everyone over the age of 65. Now, in 25 years' time, that will go from 3.4 people working to 1.8. So effectively, we have a health care model that is totally unaffordable for the next generation. So as a result of that, I felt it was absolutely important that we looked to see what has been tried elsewhere. Now, in New Zealand, they have come up with a new system which sounds very simple, but its prevention is better than cure. On the Isle of Man at the moment, we wait for you, Paul, say, to have a heart attack, to get cancer, to have a stroke, get type 2 diabetes, and then we treat you. And that means a trip into a hospital. Hospitals are an expensive place to be. They're also not a good place to be with various diseases, etc. So if we can keep you out of hospital and living in the community, that's got to be the way forward. And that's what New Zealand have done. They've gone for more preventative measures. So they've invested more health and social care in the community, enabling people to live in the community. They give more education to the schools on healthy living, diet, exercise, sexual diseases, and they also they have more 24/7 cover in the community, so they will have a nurse all 24 hours of the day. They give free MOTs to people when they hit 40, so they try and stop you from having a heart attack, and that has worked. And within 3 years of implementing that policy, they reduced hospitals' admissions by a third.
Okay, you told me all that.
Yeah.
Just go and do it. Why bother going there at all now? You've just made your case that what they're doing is fine. You've done it. I'll save you £7,000 now on that trip.
Well, that would be simple. The hard detail bit is how do you implement it? How do you go from an NHS service, which is how New Zealand had been to an fully integrated into the community? And that's where the real difficulty is. And it's only by going out and speaking. We've already been doing teleconferences, phone conferences with all the people that, as possible to try and gauge as much as possible to see if it's worth even exploring. So we've done all that bit, but it's only when you go out, and I'm taking my chief executive with me because he's the expert on this. We will be going out and actually going round from north to south, looking at all the healthcare facilities in New Zealand and how they managed to integrate it. How did they manage to take services from the acute areas and put them into the community? How did they alter the contracts? How did they get the public to accept change? Because whilst the public of New Zealand are enjoying a what's arguably the best healthcare service in the world. I'm sure there were teething problems when all this happened. The New Zealand government have also offered to share with me 500 care pathways, and that's what they're going to give me when I'm out there, the details to that. Now, that took them a number of years to develop. It would cost us at least £500,000 if we were to do this. So to go out, I'm not prepared to hold public meetings to the people of the Isle of Man saying, this is what I think we should be doing, having just had a few phone calls to people at the end of the line. I want to make sure with the chief executive that this can work and that we do ensure that it works as smoothly as possible.
You're going for a fair amount of time, aren't you? I mean, this is not just a quick trip. I know it's a long way to get there, but you've got every day itemised, or some of it days off, or what?
No, we are travelling from medical centre to medical centre, from north to south. Now, 4 of the days are travelling to, instead of going direct, which is the cheapest way to do it. I think the staff have got me going via Dubai, Sri Lanka, Australia before we get to New Zealand, just for a few hours to keep the price as low as possible, because if you go direct, it costs a lot more. So 2 days either side is purely travelling. I've got a half day with the Minister for Health of New Zealand, which is an absolute honour, and obviously he will be giving us as much information on that free of charge, and that's fantastic that the New Zealand government are prepared to give us so much information that has cost them a significant amount of money. They're prepared to give that to us for nothing. I'm also going to be looking at some of the biomedicine projects in New Zealand. They've got quite a good reputation in Canterbury, because that's something on the Isle of Man we're looking to expand. It's projected that e-business is the biggest growing sector, or will be, of the island's economy, and the next one people are predicting will be the biomedicine, and that's something we need to start looking. We've already got a very small cluster on the island, but that's another area. So I consider, when you consider the budgets that this department spends, and this could be one of the biggest changes to our health service in 60 years, what we're proposing. I will be giving full presentations to the public to put it over to them and ask their questions, get their feedback. So I think it's absolutely vital that we go out and have a look to make sure it is working and that we can deliver. I'd also point out that I'm doing this in my own time. This is during the Easter holidays, when all my colleagues will be on their holidays. My family will be on holiday, but they won't be with their father. I'll be out there with the chief executive, doing this, because I think it's really important. And it would have been so much easier for me to say, no, I'm not going to go, not take any stick. But if you're going to do something, you've got to stand by your decision. Well,
that's funny, because you say you have been getting some stick.
Yeah.
Is this? I mean, I don't know if it's relevant or not. I mean, you are going economy, business, first class. What? I mean, £4,000 isn't it something that's coming in there?
I'm not going first class. I hate
business.
Paul, what I am doing...
You're going business?
I am going the approved Treasury way. I'm going economy, and then I'm going business on part of it.
Fine.
And it was quite funny in a way that when I was asked a question by one of the Douglas MHKs about this trip, that as I sit down, I'm passed a note to point out that person actually went out to New Zealand a number of years ago and seemed to forget that. And that was paid by the CPA. So I just think it's sad that people try and score points when you're genuinely trying to improve things for the people of the island.
Well, you're not that naive to think people wouldn't be asking these questions, surely.
Well, I expect to be asked questions, Paul, yes, but it's the way people ask. I don't mind anyone asking me a question. If they've got a valid point or they've got a genuine concern that they come to me, I'm more than happy, and I accept that I should be asked these questions. It's the way the questions are put. It's put for, sometimes it's put for political gain rather than for the benefit of the people.
And that's why I seeked you out here today, because just to get on the record, as you know, we don't edit these things, so every word there is going out. So you absolutely, obviously, clearly convinced you're doing the right thing here?
Absolutely. I just can't think of any reason who in their right mind would want to suggest major changes to the health and social care service of the Isle of Man without seeing for themselves first that it works. And not only that, there's £500,000 worth of care pathways that we're getting free of charge by going out to see the New Zealand Health Minister. This is a few £1,000s as opposed to, I mean, my department has £6 million under its current budget overspent in the health side of things at Nobles Hospital. We have to do a good service for our people, but we have to live within our means. And at the moment, our health service is struggling to live within the budget it's got. So we can't expect the next generation to find double the amount. So we've got to look at new procedures.
Finally, are you hoping to get any of this through before the end of this particular regime, this administration,
Yes.
or will you be looking for the next one?
No, it's something, the sooner we start it, the better. I mean, obviously the problem isn't going to get really serious for a number of years yet, but which health minister would not want to introduce a health system that is prevention, that stops, significantly reduces the people from getting ill? And that's what the Canterbury model has done. So why should I hold back? The minute that we're sure we can deliver it and that we've got the support of the people of the Isle of Man, then I think we should be implementing not all of it straight away, but there are certain elements we can start straight away, and that's what I'm looking to do.